any questions that you may have.
Fantastic. Thank you very much, Cami. Hello, all. I'm James Cairns, a consultant with PCG. It's possible that you may have corresponded with me over email or even met me during on-site visits last year. Uh, we're going to go ahead and begin today by running through the agenda for today's meeting. So we're going to start with an introduction. That is going to go into a little bit of the program background. From there, we'll talk about new and revised measures for the 2023 program year. We're going to look at the 2023 HQIP timeline. After that, we'll transition into section 2, which is about the DCT, or the data collection tool. We'll talk about accessing the application, look at user roles within the application, and then highlight some of the key features of the application. Following that, we'll do a live demo of the application, so covering some of the topics talked about in section 2 and a bit more. Following that, we'll look at the scoring review and reconsideration process, or SRRP process. Following that, we'll open it up to questions. But again, if at any time in the presentation you do have a question, feel free to offer that in the chat, and we'll try to field them as they come in. Okay, so before we move into the content of the meeting, we just want to go ahead and launch a quick poll here. So it'll be a poll through Teams asking about your confidence with the data collection tool. And then at the end of the webinar, we'll be taking a look at the same. So again, this poll is going to be a 5-star scale, asking how confident do you currently feel using the data collection tool to complete the HQIP survey, 5 stars being the most confident, 1 star being least. Okay. It looks like we just have some responses coming in here. Let's see. So of the 38 responses we've received thus far, it looks like an average of 3.2 stars. So folks are right in the middle there with their level of confidence before today's training. And we hope that through the course of this webinar, we're able to raise that confidence level a little bit and help you out with any questions you may have. And I do believe I see a question in the chat. The question is, has the conditional logic document come out yet? The answer, Carol, is yes. The 2023 conditional logic document has been posted, and I think that we can go ahead and get a, that may not, I mean, is conditional logic published as well, in addition to measure details?
So the conditional logic is not published on the website, but we will be emailing that out again after this training within the next few days. So make sure that your email is current and up to date, and you should be receiving that here shortly.
Fantastic. Thank you. Yep. So that has been released to an existing mailing list, and we'll be sending out another based on our updated mailing list following the programming here today. Thank you.
Do you know how to help us look up a computer in Live? There's one in there that has your name on it, but I don't know if it's the right. Oh, no, so
Okay, so we'll go ahead and proceed here. So a little bit about the program itself. So the Colorado Healthcare Affordability and Sustainability Enterprise Act of 2017. So that statute authorizes HCPF to pay an additional amount based upon performance to those hospitals that provide services that improve healthcare outcomes for their patients. So again, health quality incentive payments. The Hospital Quality Incentive Payment Program payments are based on each hospital's performance on the measures recommended by the HQIP subcommittee and approved by the Chase Board. Public Consulting Group, or PCG, was awarded the contract in December of 2017 to develop customized quality measures for the state of Colorado's HQIP program that will address the most critical healthcare quality issues facing Colorado. In addition, PCG, so that is our group here, was tasked with developing a web-based data collection tool, or DCT, that replaced the online survey to collect the hospital quality metrics relating to areas of improvement, within Colorado and calculate the provider-specific scoring that'll be used to determine AQIP incentive payments. So just a little bit of background about the program. From here, we're going to go ahead and hand it off to my colleague from PCG, Michael Joseph, to talk a little bit about measure revisions upcoming for the 2023 program year. Michael, the floor is yours.
Thank you. In the 2023 HQIP survey, there are very few measure revisions. The first is in zero suicide. In the revision for this measure is that hospitals must have attended at least 9 meetings of the Zero Suicide Learning Collaborative during the measurement period. And that's reflected in the measure details and will be reflected in the data collection tool. For the reduction of racial and ethnic disparities patient safety bundle, labor and delivery hospitals will have the option to include in their response how they are approaching key aspects of the measure specific to peripartum patients, but a response specifically addressing peripartum patients is no longer mandatory, and you'll see that reflected in the DCT. Go to the next slide, please. The biggest change in measures that was for the 2023 is the advanced care planning measure. The advanced care planning will be scored by setting a performance threshold for the hospital's advanced care planning rate. And the performance threshold is 95%. Those above the threshold will receive the total possible points, and those below the threshold have the option to receive points if they provide a narrative. And the narrative has to have addressed 3 points. It has to address the process for discussing or initiating an advanced care planning when a patient doesn't have an advanced care plan or when their advanced care plan is not available to the hospital. It has to address the process and systems for documenting advanced care plans in the medical record. And then it also must address any efforts underway to improve the hospital's advanced care planning rate. So those are the changes for 2023. So I will send it back to you, Jim.
Great. Thank you very much, Michael. So now we'll talk a little bit about the 2023 HQIP timeline. So big date coming up here. May 1st at 9 a.m. will be the launch of the data collection tool. So at that time, you'll be able to access the 2023 survey within that tool and begin submitting information. The tool will close on May 31st at 11:59 p.m. So all responses must be in by 11:59 p.m. on the 31st and attested to. Between June and July, those submissions will be scored. Following that, preliminary scoring reports will be released to hospitals, and the scoring review and reconsideration period will begin within 90 days of DCT close. So for those who don't have a calendar up in front of them, that will be early August. Following that, step 1 of the scoring review and reconsideration period, or SRRP, ends 10 business days after the preliminary scoring letters are released. So once those letters are released, 10 business days afterward, the SRRP begins. From there, step 2 of the SRRP, the escalation phase ends 5 business days after step 1. On-site reviews are to be determined. So those will be scheduled based on scoring closeout dates. And then mid-September, the expectation is that scoring letters will be out to hospitals. Okay. So now that we've discussed the timeline a little bit and what's upcoming, we can take a look at the data collection tool itself. So the first component of the data collection tool is accessing the tool. So to access the application, there are a couple ways to gain access. The first would be reaching out to us at cohquip@pcgus.com, and we can go ahead and send you a registration link, or you can work with your facilities provider administrator to have them add you as a user. So there are 2 pathways there. that you can be added to the DCT if you don't currently have access. The DCT will be accessed following this link, and I believe one of my colleagues will go ahead and pop a link to that in the chat here. Upon receiving the registration link for the DCT, you'll be brought to this page within the portal. This is how you're going to reset your password. Those registration emails come out with a temporary password. So upon that initial login, you'll be updating the temporary password, meeting the criteria above, and then setting security questions for password reset below. Fairly standard stuff for setting up an online account. And I think we just have a couple questions in the chat here. Sorry, is it 10 days or 10 business days? Stephanie, can you clarify which component are you referring to there?
Yeah, sorry, the scoring review and reconsideration period, you
Mhm.
switched the slide too
Ah.
fast. I was trying to take notes and didn't catch
Mhm.
if it was 10 days or 10 business days.
I am happy to
Business
walk
days,
it back. Absolutely.
Perfect, thank you.
Yeah, so it's 10 business days after the preliminary scoring letters are released. And again, for those who would like to take a look at the timeline, screenshot, things of that nature can do so. And then step 2, 5 business days after close of step 1. And then our second question is, when are payment letters expected after the final scoring letters? So I believe that, and Michael, are you able to help me on the timeline for the final scoring letters with payment? Is that the mid-September?
So the payment letters are delivered after the Chase board approves payments.
Correct.
So they are usually in the following year. So they're usually in the spring of the next year.
Okay. Yeah. Thank you. Yeah. So definitely some lead time there from final scoring letters to the scoring letters with payment. Great. Go ahead and proceed to the DCT. So again, just be updating the password once you receive access and updating security questions from there. So there are 3 different user roles within the DCT, 2 that apply to providers. So the first user role is application admin. That is a role that's held by PCG users and HICPUF users. Allows us just a little bit more of administrative access behind the scenes there. Provider admin is the highest level of provider access. So that's the level of access that allows you to add additional users, edit some facility information, and then also complete and submit the HQIP survey. And in addition to that, we have provider participant access. And provider participants are only able to complete and submit the HQIP survey for the facility that they are assigned to. So once you have logged into the application, updated your password and security questions, this is what the homepage will look like. So you can see that there's quite a few tabs here. We have a drop down for the fiscal year. You're able to select the provider. So if you're associated with multiple providers, certainly you'll want to use that to ensure that you're looking at the information for the correct provider. And then the tabs below jump you to a number of pages. And we'll talk about what those pages are on the following slide. So the application pages are as follows. User management, fairly self-explanatory. That is for adding new users and updating user information. Great. So user management for adding new users and updating user information. Provider management is going to be for editing hospital level information. That's something that's, again, only accessible if you are a provider admin. The HQIP provider survey, that's going to be where you collect hospital quality data. So both provider participant and provider admin level access will allow you to use that tab. We have the HQIP provider survey summary. That's where you can view all survey measures and questions and track survey progress, sort of your table of contents for the survey itself. Survey confirmation / submission. That is for completing survey attestation. So that's by hospital executives or really the person that is responsible within that hospital for attestation to the data submitted. Reports, which will give you the ability to view the hospital survey questions and answers, survey submission and attestation information, and survey scores. So the user management tab, what does this look like? So if you're a provider admin, this will be what the user management tab looks like. So again, a few things to note here. Important information, you can add a new user using the bottom, the button in the bottom left that we have pointed out with this red arrow. So after clicking that, you'll be able to add this information for the new user and then designate their user role. So with that, we certainly ask that we have contact first name, last name, position, email address, and contact phone number. For temporary password, that will be something that you are able to choose. So if you are adding a new user as a provider admin, again, whatever you'd like that temporary password to be, you can go ahead and set that. And in the automated email that is sent out to the new user, that temporary password will be provided to them. Provider management, again, this is another section that is specific to those provider admin accounts. This is an area where you can edit some of the provider information for a hospital. So again, I say some, not all. We'll have provider name, provider fee ID, Medicaid ID, and Medicare ID. Those will be locked. However, provider address, provider phone number, provider fax number, and then the primary contact person for that provider can be edited. Certainly, if the provider name has been updated, we know that there are changes year over year and that there may be modifications that need to be made to this. That is something you can reach out to us for assistance on, and we'll go ahead and update that. Accessing the provider survey. So from the home page, again, quite important, want to make sure that we're selecting the correct fiscal year. So for this upcoming reporting period, that is 2023, and the correct provider. So again, if you are somebody associated with multiple hospitals, using that drop down to make sure that you're working with the correct the correct provider, and then they'll simply click HQIP survey to jump to the survey itself. If you've not yet begun the survey, this will jump you to the first question. If it's a survey in progress, this will take you to the last question answered in the survey. So it'll take you to that spot where you've saved if it is a survey in progress. Within the HQIP provider survey, there is a document upload function. So this is what it'll look like in practice. What you're seeing on the left here is within the survey itself. This will be the structure of a given question. So here we have 1A3 that has a deliverable that needs to be uploaded. Again, want to note here under measure details, you can always click this link to expand a full measure description for the question that you're looking at that aligns with the measure details document. So for those that will require a document uploaded, you'll be clicking the button to the right here to upload attachments. That will prompt the dialog box to the right. First step here will be to choose files. You'll choose the deliverable file associated with that question. You'll upload the document. After uploading the document will show as being uploaded below in documents. Something I'd like to point out here is that how the TCT is developed. If you're on a question, it is locked on that question. So the document that you upload will be associated with, in this example, question 1A, but whatever question it is that you're on. If it is a document that is lengthy and only a small portion of it, say a given page in a longer document, applies to that measure, we would highly recommend that you use the associated notes to point out perhaps the page that the relevant info is on. Certainly you can mark up those documents as well for those purposes. And then in terms of file naming conventions, that's at your discretion. But we've included some examples here of file names that are associated with the given question. Makes it a little bit cleaner, easier to tell if the right documentation has been uploaded for the correct question. So here is a look at the provider survey summary. So again, this is one of the main links that you'll have from your provider dashboard. The survey summary, as I stated, is like the table of contents for your survey. So whereas clicking provider survey will just take you to the current question. So whether that's question one, if you're just starting the survey, or a mid-survey question, provider survey summary gives the ability to look at all the questions that have been answered, haven't been answered, and the various subgroups within. So again, these will have drop downs for measure group 1A. You can see the questions within there. And again, there's going to be a key. So in this example, none of these have been started. We can see that they're all gray. Those that are red will mean that they are in progress. So some questions have been answered, but not all questions are completed. Finally, we'll have a light green indicating that a measure group or submeasure has been completed. And then once they're scored, they will have a darker green color that indicates they're completed and scoring has been completed on those responses. Finally, a very important step, once you submit your survey, so final survey question will have a checkbox indicating that your survey is complete and submitted. At that time, you will get a new option on that dashboard, which is survey confirmation / submission. That is where the attestation of submission will be completed. Again, quite important to note that the survey is not complete. It cannot be scored until the survey confirmation and submission and attestation of submission is completed. So again, this is going to be somebody at a decision-making level at your hospital who is an individual who is responsible for attesting to the validity, the accuracy of the data submitted. It's been noted here that it's an executive at a decision-making level, but as we've noted in prior years' presentations, that may look different. Titles may differ between hospitals, but again, certainly internally want to encourage you to determine who will be the responsible party for attesting to the validity of the data submitted. Okay. In addition to this, we have the reports feature. So once you click reports, it'll bring you to the page that we're seeing here. There are two reports that can be generated and downloaded. The first is evaluation detail. So evaluation detail is going to display all measures, questions, and answers and points assigned to the questions. So again, this is a good one to pull down following scoring. It gives you all of the information in a spreadsheet format, so you can easily do analyses if necessary to take a look at where full, partial, or no points were earned, for internal purposes. And then the score summary report, this is something that, again, more of an administrative function, and it looks at provider information, total points assigned, the user submitting, and the attestation user. So again, if you're working with an individual facility, that report may not be of as much utility, but if you're an individual working with multiple sites, you may want to look at that breakdown for all sites. Okay. With this time, we're going to go ahead and move into a live demonstration. I'm going to hand it off to my colleague, Gretchen Moulton from PCG, and Gretchen's going to walk through some of the items that we've discussed and a little bit more here within the DCT itself. Gretchen,
Great.
I'll go ahead and stop sharing, and whenever you're ready.
Great. Can you see my screen yet?
I am seeing your screen, Megan.
Awesome. Well, I'm going to walk through how to use the DCT and demonstrate some of the things that Jim just mentioned. So you'll want to make sure you select the correct year when you get to this page. And you'll also want to select the provider that you want to be looking at. And there's a few features that we can use on this homepage. We can go to user management. And as Jim mentioned, any provider admin will be able to add users. They'll be able to select their provider from this menu, and then they'll be able to add in the details for the new user. And then they can assign them either to be another provider admin or they can just be a provider participant. A facility can have multiple provider admin. It won't take away someone else's provider admin if you add a second one. And then you would just update participant information to save those changes. You can also edit provider information as well. You'd be able to update any addresses or phone numbers, as well as changing the contact person. And once again, just hit update facility information to save those changes. I'm also going to walk through the survey summary and demonstrate what the survey looks like. There's two ways to get to the survey. You can either click the survey summary or the provider survey. The provider survey will take you right to the first question if you haven't started the survey yet, or it will take you to whatever question you have left off on. So if you stop somewhere in the middle, it'll take you to the last question you answered. So it's nice to do the survey summary so you can see everything at once. There's the 3 different measure groups. When you first start, everything will be gray at first, like the photo in the PowerPoint presentation had displayed, and you'll have to first begin on 1A1 as that is the first measure, and there's conditional logic within the survey, so the next measure that it takes you to might be different depending on your answer to the previous question. So you have to work your way through the survey to unlock the next answer. But once you have completed all questions, you're able to jump around into the different measure groups. I also wanted to demonstrate a few of the different types of questions that are asked in this survey. One of the first ones is uploading a document. So in the zero suicide measure, one example is 2A6. You have to click this button. It'll pop up where you can upload your file. You can choose your file here and then hit upload document. And I just wanted to highlight how it shows the document right here. So there's 2A6, and this is a good way to name it because it's very clear that this is for 2A6. It also will show right here in the performance measure what measure it is associated with. Another type of question I wanted to highlight is 2B1. Here you have to attest that you have all aspects of the readiness measure in place for the reduction of racial and ethnic disparities patient safety bundle. So here you'll just click yes, and then the survey will take you through various questions in regards to these different aspects. And if you do not have these all in place, you would just select no. I also want to highlight one of the new updates, the option for labor and delivery hospitals. Last year, it used to be required that they highlight any staff-wide education specific to the peripartum patients, but we have made it optional this year. In this example, you could only submit a narrative up in the first part of the question, and it would be able to proceed without having any text in the second box. But you're also able to have a narrative to really highlight specific education for the peripartum population. There's also in the zero suicide measure a table question that I would like to highlight. Here you can just type the different answers into each column, If you have multiple trainings that you would like to highlight, you can list them here. We have the option for 5. And if there are more than 5, please use this box to describe those additional trainings as well, including the same information that you would have if you had listed it in the table. There are also radio buttons as well, and I will show an example of what that would look like. Here, depending on how you answer this question, the next question will be different according to the conditional logic. But here you would just select all that it pertains to. There are also a few questions where a document upload is optional. One of those examples is 2E13. Here you can either provide a narrative and that will suffice, or you can also upload a document that includes the narrative. If you choose to upload a document, you will need to just type documentation uploaded into this box in order for the question to proceed. There needs to be some text in this box, but it doesn't need to be your actual narrative. That can be uploaded via the document route. There is also a question that will demonstrate a percentage that needs to be confirmed. An example of this is 3B2. And here you would type in your numerator and then the denominator in this question, and it will formulate the percentage for you. And you can confirm that that is the correct percentage, and then you'll just have to click this check mark here to continue on. I also want to highlight the measure details function. You can select here and see a few more details describing this specific measure. So it's useful if you want to read a little bit more about it. And when you also log on, you're able to see what your role is in the portal. If you are a provider applicant, admin, or provider participant, you can see it in the top right corner. You see your email, and then below it, you will see your role. And in my example, I am an application admin. Some of the other functions that we have here, once you complete the survey, you will need to also submit it. So you'll click submit, and then once you select submit, a new tab will populate here. I'll show an example of that. This survey has been completed already, and so there is this new option for the survey confirmation/submission, and you will need to fill out this box and submit it this way. If you do not do the attestation of submission, the survey is not submitted and will not be scored. Another feature is the reports. Jim highlighted this in the PowerPoint as well, but just want to demonstrate exactly what it looks like. For the evaluation detail report, you can select your provider, the home that you would like to look at, hospital, excuse me, and the year you would like to look at, and view report. And you'll be able to see a really nice tabulated form of all the questions, the responses, how many points were assigned, which measures it pertained to. And then in order to export this, you click the little export logo. And we recommend downloading it as either an Excel or a PDF. It's a little bit confusing in Word, and it definitely displays better in Excel or as a PDF. And lastly, I wanted to highlight the Facility Document tab. Here you are able to see your scoring and payment letters once they become available. Here you can see that there are the preliminary scoring letters and the final scoring letters. When these are ready, you will receive an email that they are ready, and you'll come into the portal to see your results. And with that, I will pass it off to Michael to talk a little bit more about what happens after the survey has been submitted.
Thank you, Gretchen. So, after all the, you all have submitted all your surveys, and they have been scored. We begin the scoring review and reconsideration process. Go to the next slide, thanks. So this is a formalized period where hospitals get to review their preliminary scores and request scoring adjustments from the department. This period is for any instances where you believe the preliminary score for any measure may be in error. The way this will work is the preliminary scores will be entered into the data collection tool. This is within that 90 days of DCT close. And a preliminary scoring letter will also be uploaded to the DCT, as Gretchen showed in that facilities document area. This begins the reconsideration period. Let's go to the next slide, please. Yeah, so hospitals have 10 business days to review their HQIP scores and request any applicable reconsiderations. During this time, again, you cannot submit additional documentation, and reconsideration requests have to be completed in this time period. Those that are after this period will not be considered. In the way that we'll collect them is the same as they were last year. There'll be a Microsoft form, the link to which will be included in that preliminary scoring letter. We're not going to accept reconsideration requests received via email, and they must be received or submitted within 10 business days of the preliminary scoring letter. The end of the 10 business day period marks the end of step 1 of the scoring review and reconsideration, or SSRP, process. Let's go to the next slide, please.
And Michael, just wanted to break for a moment. Looks like we did have a question that's somewhat related to this section. Just somebody asking for a reiteration of the answer to the question about when scoring letters with payment are typically released.
Payment letters are usually released usually it's after the Chase board approves payments, so that is usually in the spring of the next year. And then step 2, right? So the scoring review and reconsideration process. The department reviews each reconsideration request and we'll make a redetermination. Once that decision has been made, the department will notify the hospital of the decision. If an error is identified, the department will adjust the score and notify the hospital. But likewise, if the reconsideration is denied and no scoring adjustment is warranted, that will also be included in the notification. The department will respond to the request within 10 business days of the closing of the scoring review and reconsideration request step 1. The end of this 10 business day period marks the end of step 2. There's one more opportunity for hospitals to have a reconsideration, and that is the escalation period. If you're not satisfied with the reconsideration decision, they may request escalation to the Special Financing Division Director. Escalations must be made within 5 business days of the end of the SSRP determinations. That's step 2. The department will respond to all escalation requests within 10 business days of the end of the SSRP determinations. And that closes out the SSRP. So I'll send it back to Jim.
Great. Thank you very much, Michael. So we are going to go ahead and open it up to general questions. That does conclude our content for the day. But before doing so, like I mentioned at the beginning of the presentation, we do want to go ahead and submit another poll here, essentially asking the same question about your level of confidence completing the HQIP survey using the DCT. and how you're feeling about it following this presentation. So just looking for some quick responses, and then we'll get into the questions. Thanks. Yep. So it looks like we have some responses coming in, and again, our our mean score there, a little bit over 4. So everybody's feeling fairly confident. And again, um, you know, as we're working with the tool, get some practical experience. Certainly expect that that will continue to go up, and hopefully 5s across the board by the time we're finished with the data collection period here. Okay. So at this time, we can go ahead and field some questions. I know that we have a couple in the chat here. Um, and again, I do see Stephanie Brinks has asked, will there be an announcement made when the 2022 payment letters are posted? And Gretchen has answered that in the chat, indicating that yes, we will notify hospitals via email when payment letters have been posted, and they will be posted under the facility documents section of the DCT. And just looking for additional questions at this time. Certainly, if you have one, you can post it in the chat or raise a hand and come off mute, and we'd be happy to, answer any inquiries you have at this time.
Yeah, thanks, James. I just wanted to quickly add for everybody to make sure that you're able to log into the portal prior to May 1st when this does open. And if you do have any issues logging in, please contact the team and we'll get it sorted as well. So I just want to make sure that everybody is able to get into the system, have your logins so you're ready to go.
Thank you, Cami. Okay. So it doesn't look like we have questions at this time, but there is a notification that we want to go ahead and give everybody on the call today, and that is that the 2024 measure details document has been uploaded to the HCPF website, to the HQIP page. So again, 2024 measure details have been released, but again, want to be very clear, 2022 measure or 2023 measure details are what we're using for this upcoming data collection period. This is just information on the next year of the program and some of the details that will be implemented again in 2024. So use 2023 documentation for this year, but can use 2024 documentation to begin planning for the future.
Jim, I think there's 2 questions that came in the chat as well.
Mhm. Yep, certainly. Great. What is the time period accepted for antimicrobial stewardship commitment letter? That's a good question. I don't know if Gretchen or Michael, you have current year measure details or conditional logic up in the background to answer that one. But we can go ahead and get that pulled down and followed up on here. Stephanie, you asked if there are technical issues with the tool. Is PCG who we need to contact? Fantastic question. Yes, certainly so. And Cami, thank you for popping our email there in the chat. Yeah, reach out to us via email if you have technical issues with the tool, if things are not working correctly for you, and we can certainly assist you with that. Great. For zero suicide, level 3 reports to screen patients at discharge in inpatient settings. Can you explain this, please? Usually our screenings occur at admission. Okay. Michael, I'm going to go ahead and tag you in on that one regarding zero suicide and the patient screenings there, admission versus inpatient. And again, we need to follow up on the measure text there and circle back to that one. Certainly can do. Right. Yeah, so Sarah, we'll go ahead and take a look at the text there and follow up with a response. I do think we had a hand raised there. Looks like Taryn. Taryn Hyback,
Sorry,
did you have a question?
couldn't get
Oh,
off mute.
yep. Always.
Hi. My question is, when I was going through the questions that we just got, the antibiotic stewardship in one section states it's for individual groups, and literally 2 lines down it says all of group 1 must be completed to get any points. Usually if they're individual groups, we get points for 1, we get points for 2. So if you don't get 1, you still can get 2 or 4. And so the wording on that was a little confusing compared to the last few years.
So
it's in the
the
conditional logic specifically.
yeah, so the antibiotic stewardship measure was scored the same way last year, and the way it was scored was there was the threshold of completing level 1 to be able to earn any points.
So it makes it not independent groups, is that correct?
The groups 2 through 4 are independent of each other, but hospitals must meet level 1 to get any points.
Okay.
So you could get points on level without looking at the criteria. You can get point if you earned all of level 1. You could also get points on 4 and not get 2 and 3, for example.
Okay, got it. Thank you.
You're welcome. And then, Sarah, in terms of your zero suicide question, we'll follow up via email with a response. So if you could just put your email in the chat, we can make sure to follow up with you.
Right. And Michael, looks like there's a follow-up there. Is there a threshold on staff education in regards to zero suicide?
Yeah, I'll we'll respond to all of
Do
those
that.
via email.
Fantastic. Okay. All right, folks, additional questions at this time? Okay. Not seeing additional hands raised or questions coming through in the chat. So gonna go ahead and advance to contact information. So for program-related questions, can certainly reach out to Matt Haynes, Special Finance Projects Manager, at the email on the screen, or Public Consulting Group LLC, so the cohquip@pcgus.com email address. And then for DCT-related questions, again, encourage you to reach out to us, let us know what's going on, and we'll help you through that. So that's going to go ahead and conclude our session here for the day. Again, want to thank everybody for their attendance and participation. And if you do find that you have additional questions about the content presented, you can go ahead and follow up with us via email. We'd be happy to field those questions and help you through just anything else that is hanging out there related to completing the HQIP survey through the DCT. All right. Well, thank you, everybody, and I hope you have a great rest of your week.
Thanks, everyone.
Thank you.